One of the most common queries we get is why a particular blood test is needed for a particular patient. As much as possible, the recall overview is designed to give you the answer. So, for example, at this practice, we've been asked, why is the patient needing a PSA? If you come down, further down on the recall overview, you can see here all the conditions that the patient's got and what the monitoring is. And if we click on the drop down here for prostate cancer, we can see basically the system will bring them in for a PSA every 12 months. If it's been set up to be more frequent, so the consultant wants it 6 monthly, that would show here as something that's manually set up. So 9 times out of 10, hopefully more, you'd be able to see exactly why that's the case. You might want to review that as a practice, you might want that changing, but the reason at least should be there. If the reason isn't there, or you want a bit more detail, there's another way you can look, which is really useful. You can right click on any of these are all status alerts. They basically work in the same way as the alerts below patient demographics, and you click, why is this alert on this patient? When you do that, it will bring up this screen. This is a little bit tricky to interrogate, but thankfully last night System 1 introduced an update which makes it a little bit easier. So we can see here the patient is in the report PSA due. This bit here is about an active local reminder. We're not so interested in that. That's a localized thing for the practice. The bit that's driving it is that this patient is due their PSA. So you then kind of drop down and you keep going. So there's different reasons here why PSA might be due. So it could be that they're in the monitoring due and they're not under the hospital, but that's not what's driving it, because we can see that from the big red cross. Or we click on here and we can see PSA needed annually due, and that's a nice big tick, so we can follow that. So understandably excludes female patients. They're not in the report PSA in the last 12 months. So if he'd had it in the last 12 months, it wouldn't be due. And it is in the report PSA needed annually. And we can keep on following this. So we can now see different reasons here for that. And here, tick prostate cancer diagnosed. And we can even look at the diagnoses and when they were coded. There are others that might be here. And now, this is a new thing. It now shows a question mark. The reason it's a new thing is because System 1's gone, okay, they're in that one. Actually, it doesn't matter if they're in these reports. And whether they're in those reports or not, that the fact they're in this one means that they will be in the PSA needed annually. Previous to last night, it showed a tick there, which was a bit confusing because it didn't actually mean that they were in that report. If you want a really more in-depth way of looking into this, what you can do is go to the clinical report, right click on that and click run on current patient, and it will show you more information. So anyway, that shows us, it's a little bit complicated, takes a bit getting head around, but why exactly that patient needs that now. If you're just interested in why, for example, are they in the prostate cancer register, you could just skip straight to that and right click and do, again, why is this alert on this patient? And it will show you those drop downs. Hope that helps. The more you do it, the more you get used to it and the more sense it will make, we promise.